was my baby, right? This is my baby. It will forever be that. And when you have the original founder still a part of the team, um, I have to find ways to create things and let go when I used to be able to create things and keep it close. And I say that I use the scholarship, Brenna being one of the scholarship chairs, for example. It's Brenna, DeMonica, and then a VP of scholarship, Trish. Um, and the scholarship was one of my first babies outside of, before it even became a nonprofit. But it got so big that, like, first year 50 applicants, second year 80. This last year was over 120 applicants that applied. I can't do that and be a board chair. That it's not even possible. Like it's. I mean, you could, but I would be hurting my organization if I stayed on the committee. Even if I stayed on the committee. So now that is completely ran by that scholarship team. And I come to say hi maybe twice.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Welcome to episode 124. My name is Omari Richards. Thank you so much for joining me. And if this is your first time tuning in, welcome. Be sure to subscribe so you don't miss any other great information like this. And please leave a like and a review. It helps the show get out to a lot more people, and I greatly appreciate that. So be sure to do that before you leave. Today's guest is doing amazing work with her nonprofit Sisters in Public Health. I can't wait for you all to understand how she started this and didn't really intend for it to be a nonprofit, which I think is exciting because you hear many times people starting things because they wanted to be a nonprofit, but this was not the case. As well as the adversity that she overcame in life to do what she's doing is really inspiring. And I look up to this leader, and I hope that you all are able to enjoy this episode and take away all the great insights that I did. Enjoy. Today, we have a mental health advocate, entrepreneur, author, and public health professional. She got her bachelor's in health sciences and allied health at Portland State University before working in the AmeriCorps VISTA Program and then a grants and communication coordinator position. She then got a Master of Public Health at the University of Texas Health Sciences Center at Houston, or UT Health Austin, along with being the Delivery System Reform Incentive Payment, or DSRIP project manager at Harris Health System. She is the founder and president of Sisters in Public Health, as well as an author of a kid's book about suicide. We have Angela and Frazier, MPH. Welcome to the show.
Thank you. Thank you for having me.
I am so excited to have you. I've definitely been a fan of a lot of the work that you've been doing for a long time. So this is great to have you on the show.
Thank you. Thank you.
Yeah, so let's start it off. Like how are you doing? How you've been coping during these times?
Yeah, things are I'm doing good. I have been really focused on my physical health lately. That's been my area of focus in the last like 30-ish days. So I'm good. I can't complain.
Okay, well, love to hear that. Love when people are taking more care of their health. So we are rooting for you. Tell us, how do you identify, and tell us a little bit more about your personal background?
Yes, so I identify as a she, her, hers. And just some background, well, I feel like the bio is a mouthful for sure. Whenever I hear it, I'm like, man, that is a lot of stuff. But my background is I'm originally from Portland, Oregon, and I moved around a bit between Portland and Vancouver, Washington. I lived in Vegas for a bit, lived in New Orleans, now Houston. My background mainly is, from in the health sciences. So I attended Portland State University. I originally actually started at Xavier in New Orleans. I was in the I'm going to go the med school route. I want to be the anesthesiologist. I took chemistry and realized that was not for me. And so I had I was like, oh, don't even go to organic chemistry or anything past this level. So I ended up going back to Portland. So that's when I went to Portland State, and I said, okay, well, let me see what they have. And I was one of those people who I just took classes until it like got to a degree, and I just started taking health classes. I still liked health classes, but I didn't want to go from doctor to nurse. It just wasn't like it wasn't like front line what I was really necessarily looking for. Um, and then I ended up taking a public health class. It was global health with Dr. Donna Richardson. She's a graduate of Tulane University, and I love that class. Like I was like, what is this global health? Like public health talk? I was just so tuned in. And then I ended up doing um, a service trip to Dominican Republic around like kind of student volunteers and just got to learn more about like the prevention side of things. And I was just sold on public health. Like I was like, this is it. And I remember it being super early on to where a lot of my friends who were like on the medical route still or on the nurse route was like, why would you go into public health? Like, what is public health? And like, what, you know, nurse jobs are just so demanding. You'll never be out of a role. And will you even make good money in public health? But I believe I can be successful anywhere. So I'm one of those people. I'm like, yeah, just watch.
As you should be, and I love that self-determination, and indeed, and appreciate the story, and we'll definitely dive into a lot of those different parts that you mentioned. So I know that you travel a lot, so before we get into like anything, I know you've been to like Hawaii, Texas, Nevada, Florida, Virginia, California, Delaware, Maryland, Colombia, Mexico, Bahamas, to name a few that I just like scrolled through your Instagram. So what are some of your firstly, what are some of the favorite places that you've traveled to? And then like what have you gained from traveling in like a public health perspective?
Yeah. So and now I'm at 26 states and I'm determined to do 50 by 50, which is really gonna be easy, I think, because I mean I'm at 26 and I still have a good 20 years to go. But I would say my favorite place, which was interesting, is well, one of them I would say was Alaska. I like Anchorage a lot. Like it was so pretty snow white. And and it was a solo trip. And I think anytime I do solo trips, I'm just really looking at the details of everything. I'm talking to my Uber and Lyft drivers. Like, I'm just so engaged with just every little piece of things, which when you go with people, I think you miss a lot of like really, really connecting. Um, and I would say Colombia as well. If I was talking internationally, I would definitely say Colombia. Anytime I get to go for like 2 weeks at a time, I just think I never stay in one place. So I switch like several different, like whether it's hotels, resorts, more of the kind of like nomad style where you're more like, kind of bunked up with people. Like I've done the range, and I just think it really gets you into like the culture and the community, the food. It just makes you realize that everything that we have here in the States is like so grand. And even though it's a different scale there, or in any places, even if it's a well-developed country, it's just so much more community and connection. And it's not like about do you drive a Mercedes or do you have a nice home? Like it's just different. Like I mean, I need to live internationally, like at some point, because I'm just like, that's just the vibe. I have to do it before family and kids.
Awesome. So, well, I appreciate that, and I definitely agree in a lot of that sense that traveling is just like the best way to travel, in my opinion, is to immerse yourself in the community and just do things what people typically do, and just really try to live as a local, and really divulge into that, and you get a lot out of that. And I think you see the richness of life as well as the diversity of culture and what people want, because I agree completely. And I was talking to my friend about this the other day. Is this true? Talking about what's the differences in like the United States and Trinidad, and I was like, just the culture of life, that people more so want to enjoy life than accumulate wealth or do these things that people in the US I think are more focused on. So it's just like different values around what is important in life, and understanding that people value different things. And I think understanding that diversity is great, is awesome. So I appreciate you sharing that a lot.
Thank you.
And
Thank you.
and I know you shared a little bit earlier how you got into your global public health like world, but
before, well, I guess to accommodate all of that, like what does public health mean to you? And we'll get more into like your story of finding out about it later on.
Yeah, I think of public health is population health really. There's different sides of it. There's the protection of communities and people. There's the prevention side of things when it comes to disease and health. And then there's that promotional aspect. Public health is huge. That's what I liked about it, because I am definitely someone who is a bit more like, and not even indecisive, but I just keep going, and what's supposed to be is going to be. Like, I never really was like, oh, once I got into public health, I didn't have a title in mind anymore, right? It wasn't like medical where you're like, oh, I'm going to be in the OR, or I'm going to be an anesthesiologist. Like, I just knew that it was really important to make an impact. And like, I've always wanted to live a life of service, and giving back. And I really felt like you could do that with public health. Like, it's just so broad. It's definitely the area for me.
I love that. I love that. And I think it describes the vastness of public health. The box that you put yourself into is a box of impact as opposed to like a box of a specific role or duties. And to that point, you can find your way to impact the world through public health, because there are just so many different ways to do it. So finding however you fit into that box to make that impact. Yeah. So I appreciate you sharing that. So you got your bachelor's degree in health services and allied health at Portland State University. What was the thinking process of going into this degree?
Yeah, it really was as simple as just trying to get to the finish line. Like, I just was taking classes that technically I was on the pre-nursing route. Like, once I was no longer the medical route, I was on the pre-nursing route. And so it's almost like a default. Like, if you don't go into nursing, you kind of end up with like your health sciences degree. And then because I kept taking like different classes, like communication courses, I just happened to go to my advisor one day, and like it just added up that I was going to have a communications minor. She's like, oh, you're 2 classes away from your minor. I'm like, what minor? She's like, communication. Oh, that sounds like me. Yeah, let's add that, So it really is like one step in front of the other until I get to the finish line.
Yeah, that's awesome. And what other benefits? Because I know a lot of people in public health particularly may not know about communication, or just, so what was the benefit of getting that communication minor and having like classes that were more focused around communication in your undergrad?
Yeah, I think so. I've always been someone who sat on like panels, before I really titled myself to be like a speaker or advocate of any sort. So I think it gave me like a certain skill set. I think it gave me, and sometimes that was verbal, but sometimes it's nonverbal, and like really understanding what those look like, or the ways that you kind of engage with people. Sometimes it's beneficial to relationships, it's beneficial to work. So communications was just, it really made sense. I think I'm a huge communicator. I'm definitely someone who like enjoys to talk and things like that. So it was like, when you're looking through the catalog of like, oh, these are classes I can take, when I have those like open courses to take, my mind always went to communications. Like, oh, this is how I'll be able to like get, a message out, or talk, or promote things, or mingle with different crowds. Like, I attend a lot of networking events, and I'm definitely Angela in the crowd with those who are like our young adults, and then people who will be considered my elders. You get the same version of me. And I hear that all the time when people see me in different events. They're like, oh my gosh, you're the same exact person, no matter what room that you're in. I'm like, yeah, this is totally me.
That's good. Authenticity is, I think, very important, and it's awesome that it exudes and people recognize that, and that you have that confidence in yourself to show up in those rooms as yourself in any room, which is awesome. And I think like something that people need more representation and more modeling to do the same. So that's awesome. So keep that up.
Thank you.
And were there any other undergrad takeaways that you had?
Undergrad was really about just being persistent. Like, it's long. so I really understand when like people don't finish their bachelor's, but I'm just like, for the younger people I talk to or mentees, things like that, I'm like, just push through that 4 years. Like the 4 years will go by regardless. I guess that's my biggest thing. 4 years is going to pass regardless of if you get the degree or don't get the degree. So you might as well just continue to take the courses to get it, finish, and then you have that, because a bachelor's degree is, I mean, they say it's darn near equivalent to having your high school diploma now. Like everyone has a bachelor's degree. I mean, a good majority of my friends have their graduate degrees now. So it's just something you have to have at this point.
Yeah, absolutely. Unless you're going like in that entrepreneurship route, or you weren't interested in doing like scholastic type of stuff, or like becoming like a plumber or something like that as well.
Yeah.
Okay, so you graduated from undergrad and you became a community operations coordinator at the AmeriCorps VISTA in the Black Parent Initiative. So tell me, how do you come across that, and what do you do there?
You taking me back. Okay. Wow. So I was at Portland State, and I saw like an AmeriCorps VISTA program. I was like looking for jobs and things like that. And someone had mentioned to me, I might have posted on Facebook or something. I was looking, and someone had mentioned, oh, there's a organization hiring called Black Parent Initiative, but you would be onboarded through what's called AmeriCorps VISTA, and it's a year program, and you get a stipend pay. You don't really make a lot of money, but you get to have an impact in the community, blah, 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 blah. And the plus side, when I went to go interview for it, it was the manager at the time was a member of my church. So then it was just a really like easy yes, like, oh yeah, I already know this family. I've been around her a lot. And then the team was just awesome. Like I had a lot of autonomy, although there was that strong leadership there with her and a few other managers and above. There was just that they just allowed us to just do different things. I mean, for example, I ended up writing a grant to the Portland Timbers at the time to start a community garden for the community. Well, that grant was awarded, and I was recognized like halftime at the Portland Timbers soccer. It was our soccer team in Portland. And then from there, I started, when I looked for jobs again, they were like, oh, well, there's a grants coordinator role with this domestic violence shelter. I had written one grant, but I felt strong about it. So I was like, well, yeah, I'll apply. And so I got it. So I just say that to say that just one step, like taking the opportunity to be in AmeriCorps. Also that it's really cohort vibe. So like it was like around 30 of us. Some people from other parts of the United States came to Portland. I just happened to already be in Portland, and that's where the site was based. And then it was network building. You got to learn a lot. So you had times where you were with your site, and then times where you were with the AmeriCorps actual group. And so we did retreats, we did leadership things, forums. It was a nice year of, yeah, you didn't get the pay that you wanted, but you definitely got the experience and the leadership, the guidance. Yeah, it was good.
Yeah, well, I'm glad that was an enriching experience. And yeah, people have heard me talk about like the equity issue in the AmeriCorps VISTA program with that pay, but and regardless, I think if you're in the program, you're gonna get a very rich experience, and to your point, get like that impact that you want to do. Yeah, it's gonna have to like struggle for a year.
You're gonna struggle.
but yeah.
Yeah, I don't know how the people did it who came from other places, and like, oh well, like I would have never, I shouldn't say never, I can imagine leaving like Portland and going to be at AmeriCorps VISTA in Atlanta, or anywhere else for that matter, because how would you survive? I was surviving because I was living with family. I can't imagine.
Yeah, that definitely makes sense. And that's awesome that you awarded that grant. And shout out, it's also cool. Like it wrapped into, okay, you awarded this grant. Okay, you can do this grants coordinator position, which I think is awesome, because it's like, okay, I've done it. I just need to do it more often. And so to that point, you became the grants and communication coordinator at Bradley Angle, which you said was a domestic violence shelter.
Yeah.
So talk about that process of doing that type of work and going in there.
Yeah. So this is probably the most I feel like interesting part of my pathway is going to Bradley Angel. I went to Bradley Angel in 2015 to be their grants coordinator. So I did grants and communications factor. And I was doing their social media, and so I was there for only a year. But anywhere that I'm at, I'm really engaged. Like, I'm just a very engaged person, and so I was really close with my boss. I was pretty close with our executive director. I would like stay after when there was board meetings and like, help set up things. And I just I really loved working there. I only left working there because I came to Houston to get my master's. But not to skip to that, I did a year there. I probably raised right around 100,000 in that year, as a team collective, myself and my direct report, the development director. And in that time that I was there, I ended up losing my mom to suicide. And so I lost my mom to suicide in April 2016. I had just accepted admissions to go to UT Health here in Houston. And when she passed, I had already been talking to like the other managers and coordinators at Bradley Angel because my mom was experiencing abuse in her last relationship. So I was already kind of talking to them, like, lots going on in her life and just kind of getting, connected with them, talking to board members and things like that. And then it ended up being that when she passed, the board members, some of them, and my boss went to like her service. People were like really like surrounded me and like love. I mean, it was amazing support system. And then from there, I was reached out to and said like, hey, between the funds that were raised in this last year and the things that we've done, we actually have a partnership to open up an additional shelter. And so we ended up opening up 4 shelters, and we named them the Tammy Best Emergency Shelter Program. And that was named after my mom. And so I was no longer working there, but because they honored my mom in that way without any true connection to her other than me, I found myself staying involved with Bradley Angel. So I ended up doing a yearly Mother's Day event for the moms at the shelter, doing a basket give back for the moms, where we put like a bunch of like just robes and slippers and smell goods and books and all these just awesome things in this basket to give to the moms for Mother's Day. And then from there, I ended up joining the board, and then now I'm the board chair of that nonprofit as well. So it's something that I'm like, I promise everything comes into alignment. Like from writing a grant to like applying to be, a grants coordinator, having truly no experience. And my boss at the time, that when I went into that role, I was like, I told her, I said, oh, I was so shocked that I got this because I had written one grant and I didn't lie on my application. And she said, oh, when I interviewed you, because development is in the development department. Development isn't just grants, it's communication, it's working with donors, it's bringing people like Wells Fargo or Bank of America or into the organizations to say like, to develop those partnerships. And she said, one, your communication totally stood out. And she was like, and I also just thought about like, who would I want to sit in the office with every day? She said, there's plenty of people who were actually more qualified than you. But she was like, I was interviewing you and I was like, oh, I have to work with her. But I say like, all of that literally, it just totally stacked on top of each other. And now it's a huge full circle to, oversee this organization that I once was the grants coordinator for, and just stayed a year. So
that is an amazing story. I'm so sorry that you had to lose your mom and have to lose her in that way at that point in your life, but it's awesome that it came full circle. They honored your mom in that way with, as you said, like no connection, but at that same point in time, that's dope that you're able to be the board chair and like lead some of that work, or like help lead that thing through some of that work. And you said you got, okay, what was your thought process of applying to MPH programs? So you got your master's of public health at the University of Texas Health Sciences Center at Houston. When did you think about wanting to apply to MPH programs?
pretty quickly after I started at Bradley Angle in 2015, I knew I wanted to go to get my master's started in 2016 for my master's. So I told myself I would do 2 years working. So it's funny because when I started working, my dad was so fearful. He's like, "You're gonna just like the money. You're not gonna go back to school." And I'm like, "When have I not? When have I said something I didn't do?" So I said, "No, just give me 2 years." I did AmeriCorps and I did the grants and communications there at Bradley Angle. And so I was like, I wanted to apply. I still remembered, Dr. Dawn, who I thought was amazing. I stayed connected with her. She was one of the ones who wrote my letter of recommendation for my MPH programs. And I just knew, I knew right away that I was going to go back to school, so much that, and my old boss laughs to this day, where she's like, "You told me right away after we hired you that you were going to be applying to schools." And she said, I thought to myself, why would she say that? You don't tell your boss that you're going to leave in like a year. She said, but I just laughed thinking like, oh, she's so young. She has no idea. And I'm like, that was really naive. Thank God they didn't fire me. But yes, I knew I was going to go back to school. And I didn't want to go to school in Portland. I did apply to what I considered a backup school, which was OHSU, and PSU has started a new combined school of public health. And when I say backup school, OHSU is top university. It's great medical school. It was their new public health program, but they're so well established. I was also born there. Like, it's an amazing school and hospital. But I just knew that I didn't want to live in Portland long term. So I was really focused on the states I wanted to live in, between Washington, D.C. and New Orleans and Texas. Like, I knew I was going to be leaving because I feel like the master's is the start of like the life, so that was more of my focus.
That makes a lot of sense. And then going into UT Health Austin, did you have a concentration, and what was your thought process there if you had one?
Yeah, so I went into community health, and I had an awesome advisor, Dr. Vanessa Schick. She's great. And the funny thing is, probably like a year into the program, it was only a 2-year program. The year into a program, she said to me, you should be in healthcare management. Like, what are you doing? I was like, yeah, well, I still do community health. And she's like, yeah, but you're like, the things that I was talking about doing, like, it really was more management, and I do think I missed out on that accounting and business kind of perspective. I do feel like I always say if I did a complementary degree, I would probably get an MBA. Or even a certificate somewhere in business, or nonprofit leadership, just because I feel like that's definitely where I'm at now. But yes, I did community health. My process was pretty simple. I just was looking at what my options were, and I was like, well, it won't be epi, and it surely won't be biostats. I was like, that gets rid of those. And then I felt like community health and health promotion, they kind of seemed like the same thing, except I felt promotion was too researchy for me. Like, I was like, it just felt like it was a little bit more research, and I was like, no, that's not me either. So I feel like community health was safe. It felt safe. Again, it was broad enough for me.
Yeah, definitely is very broad. And I think that's a good consideration. You also mentioned saying that the healthcare management or just a management type of concentration could have been helpful in what you do, especially like looking at the jobs that you have done after your MPH. I would imagine or I would even imagine that you have gotten experience throughout your program in those type of administrative rules, which I guess we'll get to in a bit. But yeah, that I think that's a good point for people thinking about going into the MPH programs. Really think about what is the thing that you want to do afterwards, and what are the skill sets that I need to get there, and what is the concentration that matches best with that. And I feel like a lot of the times outside of like epidemiology and biostats, you can do one concentration, but take classes or get experiences that you're able to shape into the other types of public health. So I won't get too bogged down. Like for example, you right now, you're you got a community health concentration, but you work in health administration roles or type of roles. So yeah. Okay, so while you were at UT Health Austin, you had a project coordinator. You were a project coordinator at UT Health Austin School of Public Health. So tell us a little bit about that position.
That's so. I can't really say it was too exciting. It was as simple as student work, right? It really was like, okay, well, I will. I need to do something, you know. So nothing really exciting happened in that time frame. I almost feel like we should just go ahead and X this part of the conversation out, because I'm like, it was as simple as I just needed work study.
Okay. Understood. That makes sense. So you're also the executive director of the Student Association for UT Health. So tell me about that.
Yeah, now that was a good time. So I wanted to be involved. I wanted to do some type of leadership, and leadership for students was to get involved with the student association. So there was like community roles and volunteer roles, and so you have to do the very first role first, and that was like the entry level, like do something around like helping us, volunteer out in the community, things like that. So that's what I started with, and I set up like for us to do a Houston food bank activity. But then the next year, you can apply to be the student. It's pretty much the student body president. They call it the executive director or something of that sort. But it's a student body president. I only wanted it because you get to be the student commencement speaker. That's it, and that's all. I was like, but I'm telling you, when I applied to get my master's and when my mom passed, I manifested and visualized two different things. One, I said, I'm gonna speak at my graduation. And the weirdest thing is I didn't know how I was gonna do it. But like all I could think about was telling my story at graduation. That's all I could think about, because literally April 1st, 2016, I accepted admissions. My mom passed just 3 weeks later. And I mean, I could have, deferred a year, like I could have stayed back. I talked to my advisor at the time. She's like, oh, you can start later. But I just was so determined. I was like, no way, like I'm going to be the student graduation speaker. I just knew that that's what I was going to do. And so when I was looking at student leadership roles, one of them said that, but you have to serve a term previously and then go up to that role. And I was like, this is me. I'm doing it. So as soon as they accepted me for that role, I called my dad and I was like, guess whose daughter is going to be the student commencement speaker? Like, and he's like, how did you do? I'm just telling you, I just knew like that's what I needed. I feel like it was one other thing that I was going to mention as well about that process, but I don't even recall anymore.
That is absolutely fine, but congratulations to you. Shout out for the manifestation and making it come through, and then like finding that path to becoming the commencement speaker, which is like, that's amazing. Did you have a lot of leadership skills or attributes before this, or was this like your first leadership role?
I think this is, I think this probably was one of my main first ones. I think other than that, it really was just helping and assisting leaders, right? Just like, like I wasn't the director in development for the shelter, but I was the coordinator, and like anything that, she wasn't able to do something, like I was always, really, happy to help with different things. And then like, I'm just really observant, like I'm someone who's really, really just intrigued by other people's pathways, for sure.
Yeah, that makes sense. And absolutely have to be a leader in like the work that you're doing right now with Sisters of Public Health, but we will get to that in a bit just now. So you were also an administrative intern at Houston Methodist. So tell me about that experience.
Yeah, so Methodist is awesome. It's the leading hospital. And it's like been #1 in Texas for who knows how long. Definitely #1 in Houston. They lead medicine, and I wanted to be at the best hospital. That was my thought process when I was at UT Health. I just wanted to. I moved here with the intentions of like staying. I knew we had the biggest medical center in the nation here in Houston, and that's my biggest focus. I was like, I want to be at this school. And then when it came to like applying for jobs, I wanted to be at the best hospital, and so I went to Houston Methodist. I interned for a bit, then I was brought on to be an administrative coordinator and then a volunteer coordinator. It was a stepping stone. I just wanted a foot in the door to the best hospital, and that's really what it was. Like I just wanted a foot in the door, and I'll find a way to work my way up. And I did from intern to admin coordinator to volunteer coordinator. Admin was part-time, then volunteer was full-time. But I wasn't satisfied. It wasn't in the public health realm, right? Like it was helping others get to their pathway because I was working with, the teams that were coming on to volunteer and creating schedules for the emergency department and all the different areas students wanted to volunteer in, and work with community partners for the hospital and things like that. But it wasn't where I wanted to be, but I definitely think it helped lead to the next step. And I just continued that networking mindset, whether it was like networking within internally with other Houston Methodist employees, or just continuing to network with mentors and other organizations outside of Houston Methodist. Because I just knew like I'll move up to the next step. I just didn't know would it be internal or external.
That makes sense. And it's great that you have like this direction to say, okay, I want to do this type of internship. Let me look for the best hospital, and then you find the best hospital, and then you find the internship that way. I feel like a lot of people just kind of run around with their heads cut off looking for internships, and I feel like being a little more directed, or like knowing what you want and then finding opportunities that way could be helpful. Sometimes running around with your head cut off works out as well, but definitely. And you also had another internship as a community benefit analysis analyst at Catholic Health Initiatives. So tell me about that one.
Yeah, so we have to have a practicum during our MPH, and so the volunteer department didn't feel like that. So I just was interning there and let that be that. But then I started to reach out. I started to think about, well, I want to be in a director role eventually, or a VP role, and so on. So I was connected with one of the UT Health alums who was at the headquarters of CHI, because we have CHI here, Catholic Health Initiative, in Houston, right next to Methodist actually. But the headquarters was in Denver, and our alum was the director of healthy communities there. And so I had a phone call with her, and she's still one of my mentors today. She's phenomenal. And we were talking, and I just said, I really want to fulfill my practicum there. Is there any way like I can do some things like, virtual and in person? Like, would you, do it that way? And this is before we were really doing the remote vibes. And she's like, oh yeah, like I can do that. We'll meet weekly. We'll do this, we'll do that. And I said, I want to come, and I love to travel. So I was like, I'll fit the bill. Like I went there twice, midway through, and then to do my final presentation, and stayed like a hotel, like directly across the street. It was a great experience. Her leadership is next level. I'm still waiting for her to open up a position for me. She always jokes and says, you're going to hire me. I'm like, no. She's now the VP of St. Mary's health system in Georgia. So she's the regional vice president. She is Tama Borden. She's top notch. She's the best. And so I just stayed under her wing in that leadership role. I got to learn a lot about like needs assessments for the communities, and visit their hospitals and learn more about like how they partner with other organizations. And I just was her shadow as much as I could be on different meetings, and I just soaked up anything and everything I could with her leadership.
It's always great when you can be with great leaders and just mirror them around and just lean everything that they're doing, and as well as work with them. And I hope she does open that position for you sometime in the future.
I'm not going to tell her to listen to this.
As you should. And you also said you were administrative coordinator at Houston Methodist, where you were an administrative intern before, and that was a part-time position. So was that also during your MPH program?
Mm-hmm. Yep.
And what did you do in that administrative coordinator position?
Sit at the front desk and greet people that walk in.
Got you.
I'm telling you, it was a stepping stone. I was right sitting at the front desk and greeting volunteers in the administrative coordinator role. And then when I got the volunteer coordinator, I got put in the back office with three different, well, me plus two others. And then I would help volunteers be placed around the hospital. But nothing, it literally was very basic. It just was the prestige of saying that you were at Houston Methodist Hospital, and of course you got like all the bonuses that everybody would get. I mean, they like love on their employees. Most people don't leave Houston Methodist for other organizations, especially how I went from Houston Methodist to Harris Health System, which used to be, is more we serve more the county, right? We serve those who are most vulnerable. Our hospitals for Medicaid, Medicare, and uninsured patients. So even the population, like to walk into Houston Methodist, like there's an employee choir and there's a piano and I mean it's like it's a beautiful hospital to walk into. I mean, it's very clear. I mean, George Bush, the former president, goes there. Like it's a prestige. Like there's a suite there. I mean, it's an amazing hospital. But I also kind of got to a point in my career that I thought like, is this what I really want? Like, am I really feeling like I'm doing service? And again, not to say that they're not. They're surely working hard. Like that they're leading medicine. They're awesome. But what I was doing there just wasn't it. I wasn't making an impact in volunteer services. I was helping others on their pathway, and that's okay.
Yeah, it wasn't it for you. And I think understanding that and knowing that this is a stepping stone for your next step is important. So there it is. And in 2017, you created Sisters in Public Health. And I think it began at UT Health School of Public Health in Houston, Texas.
Yes.
So tell me how that started in 2017. Or actually, what was your thought process going up into starting it?
Yeah, that was the other thing I forgot earlier. I knew that I wanted to be the commencement speaker. I knew I wanted to start an organization for women in public health. And so in 2017, well, I thought about it in 2016. And so I've had the name for different things come up to me at random times. And I was actually just laying in bed and it just popped in my head and it was Sisters in Public Health. And it was just like, boom, it came in my head and I wrote it down. And I was like, okay, well, what would I want this to be exactly? And I had this vision that there would be this association and network of women who come together in like sister circle fashion, right? And meet and have happy hour and talk about self-care and anything that we're going through in our life. And so the first flyer literally says RSVP at afrazier1991@gmail.com. That's what the first flyer says. And I love that flyer. And I created it, I remember back then, and I posted it on my social media and start sending. And then because I wasn't student association, I had the leverage of like, they would let me put things on the bulletin boards and things like that. So I said it was with the student association. And like 30 plus people came, and I only set it up for like maybe 10, and then like 10 more would come, and we come up and add chairs and add chairs and add chairs. And then after the first one, it was super clear that we had something good because everyone was like, when's the next one? When's the next one? When's the next one? And I was just like, oh, wow. Okay. I'm not sure. This is like I don't know. I had no real plan. I was like, well, I didn't want to say monthly because I like to do things that's sustainable. So I was like, well, I'll do something quarterly. And like, oh, that's too much. I'm like, well, and nobody else is helping with it. So I'm like, it's gonna be quarterly. So I made it to be quarterly, and then we end up graduating. And I say we because it was a lot of the same people coming to it. then when I put it in the community, the Houston community, we started getting other people that would trickle in that was like, oh, I go to Texas Southern, or I go to University of Houston. I heard about this. And I just started thinking about what were the proper next steps. And at the time I was following a trademark attorney on Instagram. And, you know, the more you start seeing something, people saying like, oh, protect your name, or it's not really yours. And that's kind of that's where I was at. I was like, oh, okay, well, what if someone tries to pretend like, because you say people go into the group, I'm like, oh, what if somebody like tries to say it was their idea or something? Like, would that happen? Like, well, people steal stuff all the time. So I just trademarked it. And then I thought about next steps. I was like, well, I didn't want a nonprofit at all. I'm not kidding. I had no interest. I already had the shelters. I told my friends for a really long time, I'm like, I'm not making this a nonprofit. This is a fun association. This is not like that. It's just something we do in Houston. And I said, well, but we should start a scholarship, you know? And so if we start a scholarship, we can open it up to nationwide. We can open it up to anyone who attends a school in the US. And so we did. And when we got all these applications, the first year we got right at 50 applications. And it was around like 50 applications, probably upwards of 15 or so states. And when we did that, I mean, this was all still not even on assistance-on-publichealth.org website. This was a tab on AngelaNicoleFrazier.com. Like, and then people start writing me and saying like, or the other chapters, and how do you get involved? And I just had a conversation with who's now the senior VP, Michaela, and she's like, Angela, you got to nonprofit it. Like, I just think we have to nonprofit it. And I'm like, oh man, like this is not what I planned for. When I tell you I was against the nonprofit, I'm telling you, I was like, why would I do that and give myself more work and create roles and contracts and non-disclosures and volunteer agreements? And my mind was just like, no. But then I thought to myself, this is so much bigger than me now. People are looking forward to just the Houston events, right? I mean, we've had people come from Detroit to Houston to attend an event, you know? And so I was like, okay, this is way bigger. And I mean, weekly outreach. Like, I was like, holy smoke. So then I said, okay, let's nonprofit it. It's already was trademarked. Let's do a website. Like, then I need to just expand. And I decided to open up just one additional chapter that was Chicago, because Michaela was up in Chicago. And we coasted that for a year. We just had 2 chapters. And then we really was able to detail out like, what would these positions look like? Like, how would we announce them? What would be our onboarding process? How would we do orientation? And also just kind of trying to scale, like, is this just hot because we're all virtual right now? Because it was 2020, we made it nonprofit. Like, oh, well, is that what it is? But that wasn't what it was. I just think people want community. People just want community, and it's a community that they benefit from, and it really is so much to be involved with between our chapters, between our scholarship, our retreat now that we host each year. So it really is it's really a sisterhood at this point.
Wow, well that's awesome that it just came from this one event that you posted on a flyer on a post-it board that more people had interest for, and then they're like, okay, when are we going to get more of these? And you're like, well, none of you guys helping me. So let's do this quarterly.
I'm not going to open up all these chapters. Somebody's got to open them up. I can't do it.
I completely understand. That's amazing. And I think it just goes through, like, sometimes we don't even have a huge vision for something. It's more so, okay, let me create a small community to help and support women at UT Health School of Public Health. And then from there just grew into something more and more. And like, I think it's also important that I saw one of my friends, Brenna, in your event, and I met her when she was in Japan. I'm like, oh my God, like there's just connection here. And like, to your point, like there's just that need for community, whether it is virtual or in person, but people are very interested in that. So I guess looking back now, 2 years into nonprofit incorporation, has that part been worth it for you in your perspective?
Yeah, it's worth it. I mean, business is business, and I believe in doing things the proper way. And that's why I was pushing against it for so long, because I was like, I just don't want the extra that was going to come with it. But it is it's the best. It's just so, it's easy, it's effortless, it's fun, it's sisterhood, it's exciting. I'm in love with Sisters in Public Health. I can't imagine it ever getting old. There's challenges for sure that we face at different times, but there's so many smart people around me that the challenge for me may be an easy solution for someone else, and vice versa. So it's just nice.
Yeah, and tell me, how did you get like very amazing people to surround you and want to be part of this and grow that? Because it just started from those initial meetings and it has grown into a full-blown nonprofit.
Yeah.
I know that you'll have like a bunch of different things when you do Facebook group. As you said, there's a retreat, there's a membership, a scholarship development series, chapter events, etc., etc. So how did you develop the like great organization or the need for people to say, okay, let me work with Angela and work in Sisters in Public Health, because this has a great vision? And tell me about that process.
So I have a really great mentor, Lou Raja, and I stay in some type of mentorship and career coaching. And sometimes it's like, for the first 6 months of a year, sometimes it's for the whole span. But I'm always getting some kind of coaching. And one of my mentors told me a long time ago, to get people involved in something, start them in the beginning. Don't bring people on months and years later. People love on what they helped start, like what they helped really bring up. And so when I wanted to develop it into a nonprofit, I actually went to the very first photo from the very first event. And I went like this, and I was like, I'm gonna text Jenny, I want to talk to Michaela, and I'm gonna text Trish, and I just went through Carly. I went through the photo, Lauren, and I was like, okay, in order to run a nonprofit, you need 3 board members. You need a board chair, you need a secretary, and a treasurer. Well, I already the board chair, so I just need 2 other people to say yes. That's kind of how I thought about it, and more than one said yes. And so I developed out the team. We got on calls and we kind of divvied up what the roles would look like, and really just each month. I mean, I do a goal retreat for myself at the end of each year in December, and so it was always about my personal and professional growth, but then it started to now be about Sisters in Public Health as well. So I had a vision for, this is what I would want to accomplish next year, and it was things were like, it's been arranged on my goal list, right? It's been titled the scholarships, right? Because the first 2 years they didn't have titles to them. The first year was just 1 scholarship. The second year was 2. It ironically went to a master's and a doctorate student. But the third year I said, well, we should name them and make it, specific that 1 is for a master's level student, 1 is for a doctorate level student, or develop out membership, or bring on X amount of chapters, or host a practicum student. So now there's much more detail around, like, at the end of each year, I'm thinking, well, I have a strategic 5-year plan now, but at the end of each year, I still sit down and say, how am I going to get everything that I have written out on the strategic plan for year 2023? What's most important? And some things will change. Like, I may have thought like gearing us more virtually was important in 2020 or 2021, but then now that may not be super priority, or the things change, or maybe the focus is on just different public health areas, or we thought like we needed to bring on a website or a graphic designer, and then it's like, well, no, we can just get someone from the team to do. So I'm always thinking about like where it costs and all that good stuff. So I really feel like reaching out to those who started with me, empowering them where they were. There's definitely challenges around delegation. Like, I tell people all the time, this was my baby, right? This is my baby. It will forever be that. And when you have the original founder still a part of the team, I have to find ways to create things and let go when I used to be able to create things and keep it close. And I say that I use the scholarship, Brenna being one of the scholarship chairs, for example. It's Brenna, DeMonica, and then a VP of scholarship, Trish. And the scholarship was one of my first babies outside of, before it even became a nonprofit. But it got so big that, like, first year 50 applicants, second year 80. This last year was over 120 applicants that applied. I can't do that and be a board chair. That it's not even possible. You could, but I would be hurting my organization if I stayed on the committee, even if I stayed on the committee. So now that is completely ran by that scholarship team. And I come to say hi maybe twice.
And now a quick break from our show sponsor. Do you care about public health and health equity? Have you been looking for value-based apparel? Well, the Public Health Store has got you covered. Rock simple value-based design apparel that will surely have others interested in engaging in meaningful conversations with you. The Public Health Store has apparel for you to rock in class, around the office, or just casually around town. Wear your values where people can see them. Visit the Public Health Store at thephmillennial.com/shop. That's thephmillennial.com/shop. And use the code podcast for 10% off your next order. Okay, now back to the show.
And I have meetings with the leadership team, but I'm not in the weeds of that anymore. The VP of scholarship reports to me and I get monthly updates, right, on what's happening. But they have a lot of autonomy. Like whether like this year they changed some scholarship questions and Trish came to me and said, hey, this is what the committee thinks we should do. And Brenna had this input on this, and DeMonica said maybe it should be this or we should do that or whatever. And there are things where I'm like, I think that should stay the same, right? Or what about a thought on this? But a lot of it is just a yes, because their sole focus is on enriching and growing and loving on this scholarship program, when my focus is on a little bit of everything. So we don't share the same vision. Like I'm not so detailed into what scholarship looks like and what truly is going to work. Like it's so many scholarships now, they're like, we need an automated system. Like there needs to be an automated submission system that we can all just go in and look at versus how it's currently set up, which is ran nice for the first 3 years. But it wasn't 100 plus candidates, So I have really got into a place where delegation and autonomy is really important, and I've changed my process of thinking from really being in it to creating and releasing, even with membership. Like I was in the weeds of helping create the membership with Stacy. But now it runs itself because it actually is automated, and Stacy checks some boxes on some different things and does some different things around that. But it's a totally different role than me being the one who was hosting the Houston events and putting together the flyers and planning the menu. Like it's so different. It's totally night and day now.
Yeah, that makes a lot of sense with the evolution of a nonprofit and to your point, being the founder and having to give up that all, because you in the beginning you did everything and you were everything about it, but like having the grace to say, okay, I'm focusing on like 1,000 feet up here, and we need people to focus like deep into these things to really get it moving, because you can't be deep in everything, because then Sisters in Public Health doesn't move forward, which I think is important, but it's a good dilemma and a point that we reach when building things.
And they're phenomenal. It goes to even just reminding myself that, like, do you trust who you bring on? Like, as a leader, you have to say, like, did you, and granted, it's an interview and a cover letter and a resume, and you hope that you pick the best candidates, but I can visually see, like, oh, there was growth between this year and that year. And that's comfort to say, like, scholarship is good, or chapters is good, and or this is a gap and this is where I possibly could come in and help with certain things, but also knowing that like there's a VP of scholarship and there's these two committee chairs who are phenomenal in Sisters in Public Health and outside of the organization. There doesn't need to be any hand holding. So I think when you build out a really strong team, you should take comfort in knowing that they see the vision. They know what you have in mind for the organization, and they may go a different route than I would maybe have chosen to go on, but it still gets them to the end point, and that's great. So.
Yeah, absolutely. And to that point, like just destination and then iterating around it, which is how a lot of people get into public health, but it's very similar with like starting a nonprofit. And then you said you started a nonprofit in 2020. When you started in 2020, what were these services or what did you offer to people in that time? I'm guessing that you had a community group of that sort, but what was first started, and then what was development of the other things?
Yeah, so when Sisters in Public Health began in 2017, it was just an association. It was super basic, bare, just bones, right? And then when we got to 2020, that's when we did the nonprofit official status. And it was like, okay, now we have a scholarship. Now we have 2 chapters, Houston and Chicago, and we expanded that year. So we put it out to open up to additional chapters. And we got a lot of chapter requests. There was like upwards of like right under 20. It was right at 17, and we only brought on 4. So that'll also tell you how I said I'm thorough on what I say and what I do. Like if I say sustainability, that's really what's important to me. So bringing on 4 of the 17 that applied is like, it was about quality. It was about, this is our first cohort. Let's get our glitches out, and they'll tell you, like, we've had, chapters challenge us and say like, okay, well, why aren't we doing this yet? Or can we do this? Or what's the thoughts on this? Or where's the barriers here? And that's really helpful. And I thank them for that pushback and that leadership. And also the things we've had to like rehab conversations about and things like that, where I have to kind of go back to what the vision is and like how much do you bring on, for like how much do you bring people into the fold, so to say, right? Depending on the different leadership levels. But yeah, once we hit that 2020 mark, it was like scholarship, chapters, opening up for expansion. We had the board, and then merchandise, like how we continue to kind of fund the actual scholarship. So putting that merchandise, Etsy boutique out there, and then just as of this year was membership, things like that. So it got a little bit, we went wider in as of 2022.
Okay, that's awesome. Thank you for sharing that evolution, and I imagine that there's so much more to come in the future.
Yeah.
But I also appreciate the point of view making that, there were 17 applications for these chapters, but you want to ensure that there's quality going out there. You want to ensure that there's sustainability. You want to make sure that your processes are working as best as possible before you like just expand and do this. And then everything's going crazy everywhere, but being focused, which I think is important. And a lot of people maybe try to expand a little bit beyond the capacity that they can actually achieve that. So I think that's awesome that you recognize that as well.
Yeah.
And then talking about what are some of the future visions, and you don't have to give us all of them, but what are the future visions for Sisters in Public Health?
Mentorship. That's a big one. It's one of our core values. It happens really organic and naturally right now. Just people connecting in our Facebook group, people connecting in our around our LinkedIn, at the events, things like that. But I really would like to see us pilot mentorship. I will be piloting mentorship with my own brand in the coming months, and that's probably how I'll test run it. And then I'm just visualizing what it would look like for Sisters in Public Health to have mentorship for these students, because our mission is around evolving and advancing the next generation of women in public health. And I think about that through our chapters. I think about that through scholarship and money. And now I'm thinking about that through the mentorship lens. I don't know when that will occur yet. And I don't have a set timeline for it. But I don't ever sit on a great idea too long, so it'll happen sooner than later.
That's good. That's a good quality to have. That's a good
Thank
quality to
you.
have. And I also like the point of view, like wanting to test it before. And I think that that's something that a lot of people don't give enough value to, is testing things. Just testing to see how it goes, testing to see like how you could improve, what if it's something that people actually want, and different things
Yeah.
like that, which is important as well.
Yeah. Oh, I love that you said, is that something that people want? That I tell people all the time, that has been why we have been so successful, is everything that we have done has been a request. Chapter expansion was a request, scholarship, more so going to the doctorate level of scholarship was a request, membership was a request. So a lot of times we're truly are answering the need. Mentorship is another request. And so, and again, ideas can come just poof, right? But one thing I feel like Sisters of Public Health does well is we truly do meet the need of our community. And I think that's why it's a latch on to, and it continues to grow from there.
Yeah, absolutely. It's always great when you're getting the feedback to build things out from the community that's using it. That means that there's already that need and that want and that community there to do that with. So before I move you on to the other position that you do right now, you mentioned earlier that you have your website, AngelaNFrazier.com, I think it is, or AngelaFrazier.com. When did you start this website? Because it sounded like you started it while you were in your MPH program, or even maybe before that.
Yeah, I think I started in my MPH program. That was a really good question, because I was sitting here thinking, I want to see if I can go on my host site to see when I started it. But I feel like it probably was. No, it was. It had to be, because I had the public health tab on there. So yeah, it would have been during my MPH program. Mm-hmm.
So what was the impetus for starting that?
Speaking. I was getting asked to speak all the time because of losing my mom the way I lost her. And so a lot of people were already requesting me to speak for suicide prevention. And I'm really processing. All my team is going to tell you, if it's no process to it, I don't want to hear it. I can't just do like, oh, well, I sometimes send this email. No. I need a clear process, and I need the verbiage of what is being sent out. And that's not a basic email you would answer, but anything that's like that we keep hearing, if there's a standard email that goes out to somebody who's asking for a chapter, there's a standard email goes out to somebody is interested in scholarship. It's just certain things that I just feel like need to be actual process. And so I was getting a lot of requests and a lot of people just word of mouth. And so I decided to develop a website because I needed people to inquire professionally. And I also feel like it's about, people are going to treat you how, I don't want to say how you allow them, but if you don't have a website, they're going to think that you can, well, they kind of do business like, oh, you can text them. No, you can't. You can't text them. Like, there's a standard for everything. Like, I see that you're a professional man. You have this website, and you have your podcast. You have a very active presence in the social media realm. I get that, and I respect that. And so therefore, I'm going to respect you and how I approach you. You're going to get a specific outreach email to you. Same for anyone, like I always go to see, like, also is there an answer to my question somewhere, And so I'm just really big on processes and being presented a certain way, and knowing that, like, hey, this is how I do business. So that's just really important to me.
Yeah, that makes sense. And that's awesome that you started that website. Awesome that you, again, speaking engagements and stuff like that. And I completely agree with the process. Like, even when we were like exchanging emails, like the process of me getting people into my podcast has been commented as something that I should sell, actually. But it is a process, and like that's always something that I'm trying to work through to say, okay, like, even after this episode, I'm like, what are the things that I do after every podcast episode, just in case I don't want to do it anymore? How do I pass that off? So, like, I'm just creating processes and systems and trying to work that out, which I think is important. Okay, so awesome. So you currently work as a Delivery System Reform Incentive Payment, or DSRIP, project manager at Harris Health System. Can you share a little bit how you come into this position, and then what do you do with it?
Yeah, another mouthful. My goodness, that's a long. Every time I say it, I have to count the limit. So I was at Houston Methodist at the time, working as a volunteer coordinator. I was networking. I was a part of a network called NAHSE, NAHSE, so the National Association of Health Services Executives. Another mouthful. And I developed a mentor in that just naturally. And so we continued to get together probably about quarterly. And I just naturally would express my interest. You know, I want to be in hospital leadership eventually. I like the operations side of things. I like projects. I can get anything from point A to point Z. I just always kind of just talked about kind of what my interests are. And then one day I wasn't even job hunting. She sent me a text and said, hey, are you interested in just being a DSRIP project manager? And I had just heard about DSRIP because my current intern at Houston Methodist got hired into the DSRIP project manager with Houston Methodist. And I was like, oh, I just heard about this. And they were like, oh yeah, there's this role for it. Send me over your resume. And so of course I put the thing up real quick, emailed it to her. She was like, oh, so here's the link, submit. And I went in, I interviewed, and I remember going into that interview, and it was a panel of there's two different panels, and one of them was women of color. And I remember leaving that and just feeling like I have to work for these women. Like I hope that they saw, you know, my potential. I just truly just was amazed, and I didn't even know a lot about DSRIP. And I was like, please don't ask me a bunch about DSRIP. And they were challenging. They challenged me with questions. I remember my boss, well, she's not my boss anymore, but one of them said like, oh, well, tell me about a project or something. And I didn't have good examples yet, like, or excuse me, some about currently in my current role where you know, and being in the volunteer department. And I was telling her about stuff, and she literally was like, not laughing, but she just was like, she said, that's not challenging enough. That's not hard enough. Do you have something harder? And I was like, oh my gosh, why would she do that? And yeah. I was like, I do. And then I went back to the shelter. Naturally, I was just going to my last experience, but she was saying that because she said, you're going from a really prestige, they have all the resources, they have all the money, they have all these things, to more county, more like, we don't have the resources. You're not going to get a credit card with your name, a business card. You know what I mean? She's like, it's different. Like you're going to be hit with challenge after challenge to come and be a project manager with the population that we serve. And are you like, can you do that? Because she was like, she even said after I was hired, she's like, oh my gosh, I was concerned that well, no, she said that in the interview too. She was concerned that my bubbly manner, like I just want to make sure you have thick skin. Like, do you have thick skin? And then I went into detail in my interview and talked about the loss of my mom. So they got like everything. Like I mean, I left that interview sweating. I'm like, why would they do that to me? But I knew she knew everything. Like she knew everything. That like I went from my professional life to my personal life. And I was like, okay, well, I was honest. Okay, well, I haven't had the most challenging experiences in the workforce, but I have lost my mom in this way. And I had to do these things, you know, and I am an only child. And, you know, you don't know about the death certificates. I mean, we know about a birth certificate. We carry one. You don't carry a death certificate. You know, like there's different things that happen after that. I mean, writing my mom's obituary, that's a big damn deal. You know, like it's in. And I think when I broke down, like I have faced adversity, it just wasn't in the professional really setting yet. She was sold. She was like, yeah, this is it. This is her. And I've learned a lot in this role. I've been in the role for a little over 3 years. My boss now works for another organization, but I'm still a part of the same team, so I still know everybody really well. I definitely love what I do. I think right when you hit about that year mark, 3-year mark, 4-year mark, I think you kind of itch for a little something more. And I think I'm ready to kind of pivot into something new. So that's, I would say that's kind of where I am too. Like right now, there will be a change for sure.
Yeah. That makes sense. And shout out to life experiences fitting in the space for work experiences, which many of the times are just as valuable. So I'm glad that you were able to share that. And just for people who might be wondering, DSRIP is a new type of supplemental payment that provides incentive payments for hospitals and other providers to undertake delivery system transformation efforts. I think I got that correct. And being a program project manager, what types of tasks do you do?
Oh man, it ranges. Project manager is sometimes I joke and I say it's just a really well-paid assistant, depending on who you're reported to. And I say that because as a project manager, so I was reporting to someone who was at that more of the VP level. And so she may be assigned to develop, well, one of them was when we went remote, right? Where we went remote and it ended up being that they were selling one or two buildings and putting everybody into a new building. And so I was working with the contractors and the construction around like where people would sit and where TVs would go and how many people were going to be on this floor and where were we assigned seats, and just something as kind of simple but complex as that. But then DSRIP is more of a quality-based program. So the focus for that was, here's our, for example, there's different bundles. There's diabetes patients, there's cancer patients, there's PD patients. Well, for our diabetes patients, for example, there is a certain percentage we should all be performing at for foot exams. So our providers at each of our clinics should be giving foot exams to 82% of their patients that are coming in at least once a year. So DSRIP looks at who's doing that and who's not doing that and what corrective action needs to be put in place. So a large part of my role for 3 years was looking at these numbers and saying, okay, our clinic X is at the 70%. So they're not way off from the 82, but let's go and meet with their leadership team to see what exactly are they doing and not doing. And then we look at a high performing clinic who's maybe at 85% and say, okay, let's bring these two together to say, hey, this is what this clinic is doing. Can you guys implement the same process here? Like, where is there a gap in nurse? Is there a gap in the provider? Is it a specific provider who's dropping the ball? And then we take it one step above and we would bring it to our top level, which is our executive VP, our chief medical officer, our chief nursing officer, and we bring them to that forum. There's a quality forum meeting that happens monthly, and we present who's doing well, who's not doing well, and what their leadership is doing to improve their scores. And so I have to kind of have a brain constantly of what clinics are low performers in these metrics, and I'm talking about each bundle had anywhere from 5 to 8 metrics. So diabetes, foot exams, A1C, hypertension, cancer is cervical and colorectal cancer and breast cancer, our PD measures, things like that. So just kind of knowing where the gaps were in our centers, who was doing well, who wasn't doing well, when's the last person sometime they were presented to the quality board, so to say, and then just having that tight relationship with our executive leadership team. And it was important. I mean, one year we brought in 60 million, 80 million, so on. So, I mean, these dollars were at stake. And anytime there's dollars at stake, you're going to have the buy-in of any leader.
It's absolutely true. Absolutely true. And this is like very important work. I think we need to continue to push health systems to do the transformation, to do the things that we know already is effective at like reducing health disparities, health inequities, but they just aren't done because of whatever processes. So I appreciate the work that you're all doing on that, because it's definitely needed.
Thank you.
You're most welcome. And you're the author for a kid's book about suicide. So tell me how that come about and tell us more about that journey.
Yeah, so I always wanted to be an author. I know something that I've always just wanted that title or like that prestige, you know. And probably I feel like it might have been around 20, yeah, it was 2019, the end of 2019. My old boss, who was also at the shelter at the time, she wrote a book for a company called a kids book about, and they have a bunch of books about adventure and empathy and divorce and like all the topics that we shy away from talking about. And hers was about body image, and she wrote the founder, and said, hey, I have someone who could, because they take people who have the specific story, and she said, I have someone who lost their mom to suicide. Would you guys be interested in this book, writing on this topic? And he wrote back right away. He's like, yeah, I've been talking about who can write a book on suicide, because that's such a hard one to write. And so he brought me in. And you pretty much write the book in one day. It's a one-day workshop. It's almost crazy. And you sit there with them all day. I mean, you have lunch, you come back, and you tell your story. You know, you literally are telling your story. You're answering questions. They give you the option to like type, or you can let them type. And I just want to do just like this. It's like if somebody was off to the side and just typing what we're saying and put my life story into a book right now, you know? Like, and it's easier because it's a kid's book. So it's not like it has to be 500 pages, you know? So they're writing it out, and I'm seeing it on on the big screen. And, I get to say, okay, well, let's take out that, because I don't, it's not exactly what I meant, but it's what I said, but like, how could I reword that? And it's just a really cool process. And I was really focused on two things. I wanted to write to the kid like me that's lost someone to suicide, with Frazier in the book, like, it's not your fault. It's okay to be angry. It's okay to be upset. It's okay to feel the things that you're feeling. It's not okay to blame yourself. And then I want to also write to the kid who had who has those suicidal ideation, to let them know that there are all these people who love them and care about them, from counselors, advisors, teachers, aunts and uncles. There's people you can reach out to. These feelings are temporary. That's a permanent a decision to a very temporary situation. Just this book about suicide needed both of those approaches. I didn't feel comfortable writing from either or. I needed to address both in my book. And so that was really the goal behind it. It's probably one of my best pieces. I feel like one of my bigger accomplishments definitely is a kid's book about suicide.
Yeah, shout out to you, because that's when I saw it on Instagram. I was like, oh, that's really dope. That's really, really, really dope. Yeah. That's amazing that you're able to do that. It's crazy that they did all of it in one day, but I'm guessing that was worthwhile, in the sense that you didn't have to focus on it after that. But that's really awesome. Where can people find this book?
Yeah, you can actually go to AngelaNicoleFrazier.com, and there's a tab that says purchase book.
Awesome. I'll be sure to link that below as well if you all want to check it out. We appreciate that. Yeah, you're most welcome. And before I move you on to the last section of the show, I would like to ask, where would you like to see yourself in the future?
Ooh, that's good. Wow. Probably living internationally. And that's probably part of it. And I think the other part is probably taking Sisters in Public Health internationally. Yeah.
Okay, I'll put in my part from Trinidad and Tobago if you want to make a little chapter.
Yes.
Let me know. But yeah, that'd be dope. And we look forward to seeing where it does take you, and where Sisters in Public Health goes, and everything that you get into in the future.
Thank you.
You're welcome. So moving on to the Furious Five questions I ask all guests. Yes. Number one, what advice would you give to a student trying to pursue a career in public health?
Oh, network. All I did was write people on LinkedIn for informational meetings. I just wanted to talk to anyone, and don't be afraid of a no and or a no response. Like, leaders are busy. I'm now on the other side of the fence, and sometimes I can do it and sometimes I can't. I love to do it. And then there's other times where my schedule isn't even equipped for self-care yet. And so sometimes I just can't. I can't do it, but it doesn't matter. Just be persistent, reach out, ask, ask to have conversations and develop just natural, authentic mentors.
Yeah, awesome. And like to that point of being on the other side of it, I would say reach out to people, because I know people reached out to me, I've opened the message and it's lost.
Yeah.
So definitely reach out. Awesome. That work is very important. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
The advice I would give someone who wants to get into my position is, well,
this is both as founder, president, and as project manager. So both.
Going to say, okay, as project manager, so it is good to have a PMP. I don't happen to have one, but it is a certificate that's worthwhile in getting if you're interested in being in project management. I would definitely do those informational meetings with project managers to see if it's something that you're really interested in. And I would take the opportunity to shadow or an intern with someone who is in that role to really see what it looks like, because it's different for every organization. I'm in healthcare, there's oil and gas, there's technology, there's so many different like I looked at a project manager for like Apple or something, and I was like, well, that's not up my alley. That sounds like a whole other job description. So look out there and get connected with those in that role. Someone like me for Sisters in Public Health, what I tell everyone is, first, figure out, do you want to be in my position? And why I say that is because I didn't come into this role expecting to be in this position. I started Sisters in Public Health to be the chapter chairs, to host the events, to connect boots on the ground with other women in public health. Developing out the organization has taken me further away from being on the scholarship team, being on the chapter leadership team. And I think sometimes we look at the person who's at the top and say, I want that role. And you should really actually find out what is it that you want to do, and then learn what role that you want to be
in. That was beautifully said. Beautifully said. So thank you so much. Number three, what's something you're working on improving in your life right now?
Oh, my physical health. Oh my God. That is my focus. I am so determined. I have been working out literally daily. I may take off 1 or 2 days a week. I'm meal prepping each week again. I feel so much better, so much lighter. And I've just been at it actually since September 8th. I just realized it was October 8th. So I've been at it for exactly a month, and I feel so much better already. So physical health, that's it.
That's amazing. And I hope that you will keep it up. Let's speak it into existence. Yes, this is your lifestyle now. Maybe not exercising every day, but but this is your lifestyle. Number 4, professionally, do you recommend anything besides a membership in Sisters of Public Health?
Right, that's what I recommend. But aside from that, taking care of yourself, and finding ways to, because something I've been doing lately, actually in the last 48 hours, if that, is I re-downloaded Audible books, because I was starting to get away from learning. And I think because we're not in the setting of school, sometimes, and they say what creates people really is who they hang around and what they read. And I hang around phenomenal people. I learn from some of the best for sure, whether they're mentees or mentors. But I have not been getting the oomph that I needed as far as books. And so I'm back in the books. Right now I'm reading or listening to the Viola Davis's book, Finding Me. So I'm back in it.
Yeah, it's awesome, man. I think that's important to know, especially when you feel like you come out of school. Some people have more time, some people don't have more time, but I think audiobooks has become an amazing resource to really
Yeah.
plug into life where you're not able to actually have a book. And
Yeah, just driving.
Exactly.
I did like 2 chapters of the book just driving from point A to point B. I was like, oh, this feels good. Like this feels like my brain is moving again.
Yep. Awesome. And then last but not least, where can people connect with you and with Sisters in Public Health?
Yeah, so Sisters in Public Health, best way to connect with us is the website, sistersinpublichealth.org. We also have a Facebook group, which is phenomenal. Tons of advice and questions and things to be had in that group, ways to stay connected there for sure. As far as me, my website, AngelaNicoleFrazier.com. LinkedIn, I'm very active on as well. That's a great way to stay connected with me. I'm Angela N. Frazier on LinkedIn.
Awesome. And I'll be sure to link those in the description for anyone that is interested. Thank you so much, Angela, for coming on and sharing a wealth of knowledge and a very enjoyable public health story. Despite like the sadness of everything, but where it has taken you and continues to take you, you truly are inspiring to me, and I look forward to seeing where you go in the future.
Thank you so much. I loved it. Thank you.
You're most welcome. Housekeeping items, everyone. Thank you so much for watching. Be sure to subscribe if you have not as yet. Leave a like, leave a review, share it with a friend. We greatly appreciate you. See you next week.